Here. We're going to start today by giving an update on Beta, and then we're going to shift to Hurricane Laura recovery, and then we're going to cover our continuing response to the public health emergency dealing with COVID-19. And I'm glad to have Dr. Guidry with me today. If you have questions about the data we're reporting or anything else related to COVID. Yesterday, you may know that I declared an emergency in advance of Beta, allowing the state to assist local governments with their response needs. This morning, Beta was downgraded to a tropical depression. We're still anticipating continued impacts here in Louisiana. In fact, we're feeling impacts here in Louisiana presently. Beta is expected to move through central Louisiana Wednesday night and Thursday, and it's going to be coming over land, which is a good thing. So if it's over water, it could potentially strengthen again. Right now, we're anticipating 2 to 4 inches of rain through most of the state. But one of the things that we're keeping an eye on are if any bands set up across the state and become basically stationary could cause much higher localized amounts of rain, and some flash flooding could occur. Coastal flooding continues to be a concern at least through Thursday. A total of 213 gates in the coastal zone are closed as of this morning. Grand Isle is actually engaged in a flood fight as we speak. They're using all 11 pumps that were deployed for Hurricane Sally, and they received an additional 3 pumps that were transferred from Lafitte to Grand Isle last week. St. Bernard still has 4 12-inch portable pumps that they used during Sally, and they will be used again for Beta. Plaquemines Parish and New Orleans at the permanent canal pump station. They pumped down their canals to increase capacity ahead of Tropical Storm Beta. And given the persistent 25 to 35 mile per hour wind gusts over the weekend and yesterday, many communities outside of the major flood protection systems are experiencing some levels of flooding. This includes New Orleans East and the Venetian Isles, St. Bernard and the Shell Beach, Hopedale, Yocloskey, Delacroix areas, in Plaquemines Parish around Myrtle Grove, in Lower Lafitte in the vicinity of Goose Bayou, Lafourche Parish, LA1 south of Golden Meadow to Leeville's having some real issues, and in Terrebonne Parish in the vicinity of Coquetry and Ile de Jean Charles, among others that are outside the Morganza to the Gulf protection. We're keeping a close eye on those areas, and we'll deploy flood fighting assets should the need arise. The National Guard currently has more than 2,000 guardsmen activated in support of emergency operations. Now, this is for Beta, for Laura, and for COVID. With respect to the continued response to Hurricane Laura, the National Guard is supporting 12 points of distribution today, operating in 3 parishes, and also 2 hubs in an additional 2 parishes. We continue to shelter large numbers of individuals from Hurricane Laura. As of this morning, there were just over 11,000 individuals. I think it was 11,079 being sheltered in the state. I think that's 42 hotels, mostly in New Orleans, all non-congregant sheltering. The state of Texas continues to shelter more than 4,000 Louisianans. And as always, for the latest information on sheltering, please text LA Shelter to 898-211. That's LA Shelter to 898-211. Do want to spend a minute on DSNAP. So for those who have not yet applied for Disaster SNAP, today and tomorrow are the final 2 days for Phase 2. And Phase 2 includes all 21 parishes currently approved for DSNAP. And for these last 2 days, anyone, regardless of the first letter of their last name, can call to apply. You can do that today or tomorrow from 7:30 a.m. to 6:30 p.m. The number to call is 1-888-524-3578. 1-888-524-3578. You have to call to both apply and to be interviewed. And I know there's been a little confusion about this, so I thought the best thing is to name the 21 parishes, which I will do slowly. Acadia, Allen, Beauregard, Caddo, Calcasieu, Cameron, Grant, Jackson, Jefferson Davis, LaSalle, Lincoln, Morehouse, Natchitoches, Ouachita, Rapides, Sabine, St. Landry, Union, Vermilion, Vernon, and Wynn. And please remember, if you pre-registered, that does not mean that you don't have to apply. You still have to call and apply and make sure that they determine your eligibility. So if you pre-registered, you still have to make that phone call in order to apply. You can text LADSNAP to 898-211 for more information. With respect to nutrition, there's 1 week remaining for the pandemic EBT, sometimes called PEBT program. And parents can apply for this for the 2019-20 school year. So if your child is on free or reduced lunch, obviously missed school in that school year because of the COVID emergency, and you've not yet applied for and received PEBT benefits, you can still do that. But there's not much time remaining, only 1 week, and because you have until September the 29th. And you apply at LouisianaBelieves.com, which is the Department of Education website. Now shifting to COVID, today we are reporting 730 new cases on 21,182 new tests. Sadly, we are reporting 11 new deaths that bring the total deaths in the state of Louisiana from the onset of this public health emergency to 5,218. There are 571 COVID-19 patients hospitalized across the state of Louisiana. This is a decrease of 16 from yesterday. And there are 96 hospitalized patients on mechanical ventilators. That's 3 more than yesterday. If you go back to just over a month ago, August 21st, I think it was, we had more than 1,000 people hospitalized. So we have made considerable progress over the last month or so. And in fact, you'd have to go back to early June before we had this few people in the hospital. And that's a good thing. And what that means is the mitigation measures, the restrictions are working. And this is incredibly important. But we know that it works. We also know we have to maintain what we're doing. And in fact, that's what the White House coronavirus recommendations for our state really impress upon us, is the necessity of continuing the approach that we've had that actually have allowed us to make these improvements over the last several weeks so that we can keep the numbers going down, increase the capacity in our hospitals, especially ahead of the flu season. And one of the most important things that people can do is make a plan now to get a flu shot this year. And I implore people, even if you normally don't get flu shots, even if you've never gotten a flu shot, make a plan, get a flu shot this year. They are widely available, and would ask that you do that. It is very important. I'll be getting my flu shot in a couple of weeks, and want to make sure that others do so as well. And the good news is all the mitigation measures that we have in place to slow the spread of COVID-19 also slow the spread of the flu. So when you wear your mask, when you distance from one another, when you wash your hands, when you stay home when you're sick, all of these things slow the transmission of the flu. And that's not just conjecture. When the COVID emergency first happened back in March, we were still in flu season. And overnight, when we put in these mitigation measures, the numbers of people that were going to the hospital with the flu decreased overnight. So it's really important that we engage in these mitigation measures, get our flu shots, so that we don't overwhelm the capacity of our hospitals to deliver life-saving care. And because the flu is basically a respiratory illness, and so is COVID. They put demands on the same parts of our healthcare delivery system, which is why we're so concerned about that. Do want to talk for just a moment about the new proclamation and how it deals with bars. With respect to bars, all bars are open, but not for on-premises consumption. And they can have 2 of 3 video poker machines open if they've got those. They can be open for drive-through, for pickup, for delivery. And if they applied for a conditional permit, and they meet the permit requirements, they can operate as a restaurant. But in parishes where for 2 consecutive 1-week periods they are at 5% or less in positivity, as identified on the LDH website, those parishes can choose whether to opt in to allowing bars to open for on-premises consumption, subject to a variety of restrictions. I do want to point out that the data on the LDH website is already rounded to the nearest tenth of a point, and there's not going to be any additional rounding on that. If a parish opts in, it will be allowed, again, to open bars with those restrictions until such time, and hopefully it doesn't happen, when there are 2 consecutive 1-week periods of 10% or more in positivity for that parish, again, as identified by LDH. This is outlined in my most recent executive order. Parishes that meet the criteria that I stated and would like to opt in, they simply send a request to the Office of Alcohol and Tobacco Control, or we call it ATC, and at that point ATC determines whether the parish in fact meets the criteria in consultation with LDH, and either approves or denies the request. ATC is going to continue to monitor parishes that have been approved to reopen bars. Should a parish reach that 10% or higher for 2 consecutive 1-week periods, then ATC will order no additional on-site consumption of bars until it satisfies the gating criteria again related to the 5%. LDH updates the percent positivity rates for the parishes every week, and that's on Wednesday. Anyone can access this information by visiting ldh.la.gov/coronavirus. That's ldh.la.gov/coronavirus. And this is not mandatory. Parishes can decide whether to opt in or not. And I think at this time we've got some parishes that have opted in and some that have chosen, at least up to now, not to do that. So at this time, I will take a few questions. Melinda?
Governor, can you comment on the call for the special session that was issued, if you had any input on it, and if you have any ideas for possible financing sources to shore up the unemployment trust fund?
Yeah, wow. So obviously, to me, the most questionable thing about the call is the sheer number of items in it, and the vast majority of which have nothing to do with the public health emergency. And so I think that's obviously problematic, and in and of itself suggests that there are some people who just don't see the emergency for what it is. But the legislature issued the call, and I think the speaker and the president worked together on that. I do think there's some things in the call that warrant attention. Honestly, we've talked about a potential special session in October for a while. I really believed that we were going to have some additional stimulus from Congress that we would need to appropriate. That is not the case. And then we also wanted to have the ability to have a special session if we needed to adjust spending because we weren't meeting the forecast or for some other reason. That is not the case either. But there are some things in the call that I think are warranted, and we can handle those things. I don't know why 30 days, because the true number of call items that actually pertain to the emergency are relatively few, and so we certainly shouldn't have a 30-day session in my estimation. But as I always do, I'm gonna work as hard as I can with the legislature, with the leaders, with rank and file members to see where there's common ground, and we can responsibly meet the needs of the state as it relates to this public health emergency.
But on the unemployment piece,
Oh yeah, I'm sorry. See, you asked a compound question. So on the unemployment piece, first of all, we really continue to urge Congress to work together and come up with a bipartisan consensus, a compromise on a piece of legislation, because we know that the federal enhanced unemployment benefits have run out, and we need them to have another stimulus to include unemployment in that, and that would be the best thing that could happen. Secondly, with respect to the trust fund, it would be great if when the Congress gets around to another round of stimulus, that they do have state and local funding as part of it, much like they did the first time in the CARES Act, and that the funding come to us with as much flexibility as possible so that we can deposit a nice chunk of that in the Unemployment Insurance Trust Fund, restore the solvency of the fund, and obviate the need to either borrow money from the Treasury or to continue to borrow money from the Treasury, or to get below that level where an increase on employers is going to be required. So that's what's preferred, and I would encourage Congress to make that happen. With respect to options that are available to us, whether there are CARES Act dollars left over or not necessarily left over, because the programs are still ongoing and they don't expire for some period of time. But with respect to the Main Street program, for example, is that program on a trajectory where it's going to exhaust all of the available funding? And if not, should some of that funding be moved to the Unemployment Insurance Trust Fund? And there may be some other options out there as well. I actually had a meeting with the speaker earlier today, and we're starting to look at what options we have available to us. But it is obviously a real issue. I think the balance of the Unemployment Insurance Trust Fund today is less than $80 million. Yes, sir.
On the special session, is your concern that the legislature is going to take action to try to undo your ability to enact mitigation measures and therefore cripple the state's fight against the virus?
Well, if they were to be successful in doing that, I would be concerned. I don't stand here concerned because I don't think that they're going to be successful in doing that, and I'm not sure that even represents a majority of either body's wishes on that subject matter. The fact of the matter is you cannot declare and respond to a public health emergency by committee. And the Constitution isn't set up that way either. One of the things that I would be most interested in learning is what is it that my most vocal critics are really concerned about? Because every action that I've taken has been consistent with the science and the data, consistent with the White House Coronavirus Task Force guidelines, and yet you never hear them say that when they're being critical. And so, we've had a very tough time here in Louisiana with COVID. That's no secret. We've had the most cases per capita of any state in the country. We rode the crest of both surges thus far, but both times, because of the actions that we've been able to take and the mitigation we've put in place and the restrictions we put in place, we've been able to slow the spread, reduce the numbers, flatten the curve, and get ourselves back in a reasonable position. Economy, opening our schools on the other. And I'm willing to work with anybody who wants to be constructive, but there's nothing constructive about making it where you're unable to make the decisions necessary in order to protect the public health and preserve capacity in our hospitals and so forth. Yes?
One idea the Republican leadership has floated that's, I think, an operation in other states is you couldn't declare a public health emergency or an emergency of any kind longer than 30 days without concurrence from the legislature. You just said you can't do it by committee. Why not?
Well, because the Constitution vests that authority in me. And secondly, if you try to have to get a majority of a committee to do it, that quite frankly is not a workable scenario. Secondly, when you call the public health emergency, and I don't know of any reasonably sane person who thinks we don't actually have a public health emergency. Once you call one, and the nation has one in place, at that point in time, you start entering contractual agreements with FEMA. FEMA contracts with the governor, doesn't contract with some council, it doesn't contract with all the various parish presidents or mayors. And so that construct just doesn't work. It won't work, and I can assure you I will not be surrendering my authority that's given to me under the Constitution to some council. Yes, ma'am.
I've heard from a lot of lawmakers that they're getting a lot of phone calls, even after you made adjustments last week, about nursing home visitations. People seem really anxious about that. Can you explain the rationale behind opening it up the way you did?
Well, I'm not sure by your question whether the anxiety or the concerns that are being expressed had to do with whether because we are going to allow visitation or because we haven't.
People feeling like people who are in areas where they still can't see their family.
Yeah. Well, and I'm not sure that your question relates to the most recent development there, because late last week there was information that came out of CMS, new guidelines around visitation at nursing homes, which we immediately adopted. And in fact, Dr. Guidry is going to put out a public health order, or has, and I'll let you come speak to that in just a moment, where exactly what the CMS is position is on that is going to be what we're doing in Louisiana. And there will be visitation at nursing homes. And obviously there's a real challenge there if the nursing home is in a community that has too much community spread, and you typically try to capture that information around the percent positivity of tests. But in terms of visitation, it is going to be allowed relatively soon, and with an emphasis on outdoors and making sure that it's scheduled so you don't have too many people trying to exercise visitation all at once. There's going to be distancing. There's going to be PPE requirements. They're going to be checking for symptoms, all of those sorts of things to make it just as safe as possible. And I'll remind people of the more than 5,000 deaths, more than 2,200 of them occurred among nursing home residents. And so nursing homes, or because of the congregate setting, allows for the easy spread of the virus. And then because of the vulnerable nature of the residents by virtue of their age and the comorbid health conditions, make them especially vulnerable to the disease itself, which is why we've like many other states, had tremendous challenges keeping it out of nursing homes, and then once it got there, minimizing the spread and making sure that we were doing as well as we possibly could. And we've made tremendous progress. And now we're going to move towards the visitation in the manner that I just mentioned, but we're adopting the full guidelines of the of CMS. So I don't know that there are any. I assume that you have some people out there that don't want any restrictions, but that's just not responsible, and that's not reasonable. But we are going to move forward with the scheme that I just laid out, and that the CMS has put in place. And Dr. Guidry, did you want to add anything to that, or?
I can, if you covered it well.
Okay. Yes, ma'am.
Governor, have you spoken to the state police about Trooper Hollingsworth's death overnight? And can you talk about what your thoughts are overall on the handling of the Ronald Green case?
Yeah, well, I want to remember the chronology here. I know that I spoke to Colonel Reeves a couple of times yesterday, and I haven't spoken to him today, but I did get early this morning a text message from him where he told me that I think it was around 3 or 3:30 this morning. I can't remember the time that he had actually expired. So I did get that word. I will tell you that I'm not sure what your question was alluding to, but I have complete confidence in Kevin Reeves as superintendent of the state police.
Do you think that the handling of that case and the slow response to that case, I mean, is that an appropriate response to you? And
Yeah.
have you seen the video yet of the arrest at all?
See, there you go with your compound questions again, Melinda. Yeah, I know. First of all, I'm not comfortable in saying that I'm happy with the time that has elapsed. But I'm aware that there are reasons for that, and there's an approach that has been taken for as long as anybody can remember when you have criminal investigations that are ongoing as to the sequence of events. And whether that continues to be the most appropriate approach to that, I'm not sure, and we're going to be taking a look into that and whether some changes are necessary or might be in order. I have not seen the video, and I do know that it is a matter of public record once the authorities who are conducting the investigations, which happen to be the DA in Union Parish, but also the U.S. Department of Justice for a civil rights violation, if and when they conclude that their investigations are complete, or when that happens, then the videos are going to be shown.
And do you want to see that video? I mean, are you intending to see that video at some point?
Well, I'm sure that I will, but at the present, it wouldn't make a difference as to the timeline as to when it gets released. But yeah, I'm sure that I will. Any other questions today? Yes, ma'am. You see, you didn't have to do a compound question.
No, this is a different one. This is on the bar closures. That seems to be one of the issues that has made some legislators unhappy who are interested in calling this session.
Yeah.
Where did you get the guidance that made you decide the approach that you took with bars in terms of the 5% rate, and then also in terms of the curfew, the closure time for all alcohol sales?
Well, the limiting hours and restricting bars has been in the White House Coronavirus Task Force recommendations for a number of weeks now. And the overall structure of the idea that you would have bars to be able to reopen with restrictions depending on the overall percent positivity of the parish that they're in actually came from a plan that was put in place, I believe, in Arizona first, that Dr. Birx talked about. In that particular case, if I remember correctly, they were doing it at 3% positivity and no more than 5 new cases per 100,000 over a week period. And when I looked at it, I didn't think that the 5 cases was reasonable because in a small parish, if 2 or 3 people in one family got sick over a 1-week period, then that entire parish would be knocked out of that. And so then I looked at the percent positivity, and the goal we had for a long time in getting for Louisiana was to get below 10%. And so I've looked at the 3%, but in consultation with the team, decided that 5% was the right number. And in fact, we have a number of parishes now who are qualified. Some have opted in, some have not. And then we will have an update tomorrow on the LDH website. I believe there will be some additional parishes that will have the ability to opt in. But this approach has been something that's been recommended to us by the White House Coronavirus Task Force for some time. And I will tell you that our overall approach with respect to bars, the mask mandate, and the restrictions that we've had have been very, very helpful because we that's what we did to put in place to get our numbers back under control after that Memorial Day surge. They just continued to grow unabated until we did these things. And now that we've made these hard-fought gains, we have to continue to make sure that we proceed in a way that is reasonable, that we don't lose those gains. And especially with all of the activity that we've seen in Louisiana over the last few weeks related to Hurricane Laura, and then our preparation for Sally, and then Beta, and then you had schools coming back, and university campuses reopening, and you had Labor Day. All of those things, and it's just, they thus far, and they've been very, very effective. And so we need to make sure that we continue that approach, but within reason, allowing bars to reopen. And I would hope people understand the percent positivity reflects the degree to which the disease is prevalent in a given community. And if you have too much disease circulating in the community, if you have too much community spread, then there are certain things you just shouldn't do. And one of those things happens to be having bars open without restrictions, because we know, for reasons that we've discussed many, many times, that bar atmospheres are very conducive to the spread of the virus. And so having them open only when you have a reduced amount of community spread, and then open subject to restrictions like making sure that every patron is seated, that they don't go to the bar for service, and that you have the restrictions in the hours, for example, can be very, very helpful. Yes, sir.
On the special session, what just generally would be your opinion of what would be a reasonable list of objects, of topics, instead of 70 and up to 30 days?
Well, 10 to 14 days is more than enough, and there's no reason to have more than I don't know, 5 or so objects in the call. I mean, they're just not. But obviously that's something the president and the speaker, for whatever reason, felt differently about, and we're going to negotiate the course of this special session. It just, I guess, that's part of the issue, right? You call it a special session, but you have 70 objects. It's more like a general session. And when you have 30 days to do it, then that gets close to a general session too. But again, we're going to look for areas that we can agree and work with the leadership and with the rank and file members of the legislature to responsibly govern Louisiana in these unprecedented times. And I look forward to that process. Okay, we'll do 2 more. Yes, ma'am.
Are there specific Hurricane Laura recovery items that you think are needed to be dealt with in this special session?
Not so much for Hurricane Laura. Well, yes, because we have students from parishes in their K through 12 schools who are not going to be able to go back for some period of time. But we need the funding for those school districts to remain intact so that they're able to receive those kids back as soon as that's possible. So for example, that sort of thing with respect to Hurricane Laura, and it is really important. But most of the Hurricane Laura recovery things are things that we're working with FEMA on, that we're going to work with Congress on, and so forth. And there may be some others, but that K through 12 situation, especially when you look at parishes like Cameron and Calcasieu, where their schools really can't function and those students are elsewhere. Some of those other districts that are absorbing those kids need to make sure that they're getting some funding for it, but we also have to maintain the funding flow to the most heavily impacted parishes so that they can make their school systems operable for when those kids do come back. And so that's going to be really important. All right, so this will be the last question. Yes, ma'am.
And it may be that Dr. Guidry has to answer this one. So a few weeks ago, we were told that LDH was going to start reporting case counts for higher education institutions on its website. And as far as I can tell, that hasn't happened yet. Do you guys have a timeline for when that will be reported?
I'm going to let him come up and answer that, and then I'll come back up and finish out the press conference here in just a few minutes.
So in talking to the epidemiologists and the folks that are actually working on this, a lot of effort's been spent the past couple of weeks with K through 12 and getting those schools on board. Obviously, we always have reportable diseases, and we work with school systems and higher institutions of learning. They're coming on board now, and so we're going to start reporting tomorrow the K through 12, and then we're going to continue to work with the higher schools of learning, and as they come on board, we're going to be reporting that as well. But they're just getting rolling, and so right now the data that's coming in is slow, but it's you develop an app, and there's all this reporting that's occurring, and people have to sign on and they have to learn how to use it. In the end, we all benefit, because by sharing the information, we know where the disease is, we can react to where the disease is and where it's spreading. So we're not there with the Institution of Higher Learning, but we're close, and they're coming on board as we speak. So I would say within a week or two, we should be having more and more data about those. But tomorrow, by region, we'll be sharing information on grade school, K through 12. And hopefully, as we get this information, parents will understand that by sharing their information about their kids, we can do something to mitigate the spread of this virus. But that's where we are with it, that I'm aware of. Yes, I would say that for schools of higher learning. As early as next week, we might be sharing some information, but we are working with them right now, and certainly as we get them on board, we have over 900 schools from K to 12 that have signed up, and we're working closely with higher ed to get their reporting as well.
Thank you, Dr. Guidry. As I close out, I do want to remind the people of Louisiana that the last day to respond to the census is September the 30th. We really need people to respond. As best we can determine, we're at about 90% right now, which is one of the lowest response rates in the country. And the census information at the end of the day is going to drive an awful lot of funding from the federal government to Louisiana. And so if we want our federal tax dollars coming back here in the amounts that we deserve, we all need to respond. But it also informs the way that districts are formed for congressional seats and legislative seats and so forth. So please respond to the census before September the 30th. Also today, I believe, is National Voter Registration Day. As a reminder, for the November election, you have until October the 5th to register the vote if you're registering in person or by mail. You have until October the 13th to register to vote online through the Secretary of State's office. So with that, we will next see you on when? Okay. We will let you know when the next meeting is going to be. I do want to thank you all for continuing to cover all these essential items, and I want to thank the people of Louisiana because the progress we've been able to make over the last several weeks on COVID really has been very, very promising. It puts us in a much better place than we would otherwise be as we head into the flu season, for example, and just encouraging people to continue to do what is essential for us to keep those numbers down, to slow the spread, flatten the curve. That is, wear your masks, social distance when you're not with people from your immediate household, at least 6 feet. Stay home when you're sick, wash your hands frequently, and let's make sure we protect the most vulnerable. And those people who are 65 and older, those people who have comorbid health conditions that predispose them to a poorer outcome should they contract the virus. Let's be very careful with those individuals. Understand you're safer at home and minimize your activities. If we will do that, we're going to do much better, not just with respect to COVID, but also with respect to the flu. And then I continue to be inspired by the way that Louisianans are good neighbors to one another in times of natural disaster. And so the recovery from Hurricane Laura and the degree to which we have people just being good neighbors to one another has truly been impressive. And I want to encourage people to continue that. And this is obviously going to be a long road to full recovery. We're going to work hard every single day to make sure that we're making progress. And then the efforts that individuals, nonprofits, the faith-based community making truly are inspirational. So let's continue to draw strength from one another. Let's continue to pray for God's blessings and work hard to get past this public health emergency with COVID and continue to recover from Hurricane Laura. And let's be mindful that hurricane season is still open, and it will be until November the 1st. There's still an awful lot of activity in the tropics, and we're going to be dealing with beta for the next couple of days as well. So thank you all very much, and we'll be talking to you soon.